Hello and welcome back to Kirti Institute. This is Kirti and this lesson is on OET Writing Masterclass. In this lesson, you will find all the basic information about writing subtest and we will be discussing on one task. At the end of the video, you will find the model answer. The task taken for the discussion is from official OET website and this is sample test 1. So, let's begin. OET writing is a profession specific. That means the doctor's letters are different from the nurses and pharmacist and podiatrist. So you should practice with your own task, okay, with from your own profession. Now there are basically four types of letters that you write. The first is referral letter, second transfer, then discharge or information letter. You need to write one letter only in the test. Now, the letter can be of any type, but for the doctors and nurses, there are three types of letters, and that is referral, transfer, and discharge. You will be allocated total 45 minutes, out of which initial 5 minutes are to read only, and 40 minutes are to write. But should you start writing? No, no. Big no. What should you do? That we will be discussing now. In initial 5 minutes, when you read the case notes and the writing task for the first time, you should read it as you understand your patient. Okay, so read each and every information carefully and try to infer what the case note says. Okay, you cannot put any tick mark, you cannot even hold pen or pencil in your hand for initial 5 minutes. So OET really want you to understand the case note in depth. Okay. After 5 minutes, you should start selecting the case notes. Now, how to select the case notes? That will depend on the reader. Okay. Who is the reader of your letter? So you need to see that what information is relevant, and that will based on the reader and the job that he's going to do once we hand over our patient to that person. So while selecting the case notes, you need to ask two questions to yourself. Number one is, does the reader know my patient? So if the reader is already known, probably he may know the information that you may not include. And second question that you can ask to yourself is, does the reader need this information to provide further care? If yes, you should select. If no, you should omit. Okay. Now, after selection, you need to plan your letter. And many students skip this stage, but you must not. If you want to be confident at the end of your letter that yes, you did well, then you must plan your letter in advance, no matter how easy it seems to you on first impression. But still, you should always plan because the information may not be always in sequence. It might be scattered throughout the case notes. So you need to pick up the right information and you need to think that how can I jot down and create one logical story. Okay, and you can also make a rough plan because at the back of your answer sheet you will be given the rough work, okay, rough page to do your rough work, and there you can make notes, or you can also select the information and there and then only you can make the case notes, like you can make your rough planning. Okay, so that is very important. Okay, you should think that what information or what all points will go in the first body paragraph, what other points you will be discussing or writing into the second body paragraph, and what will be the content of your third body paragraph. Likewise, you should think and then start writing. Okay, then of course you should write your letter, but see that suppose your 15 minutes are over, initial 5 minutes to read, next 5 minutes you have taken to select the information, and next 5 minutes you have taken to plan your letter, to plan your organization. Now in the exam, you are looking here and there and you see that most of the students have already completed half of their letter. But don't be panic. you are still on the right track because you still have half an hour to write your letter and your thoughts are very clear. Okay, you know in advance that what you want to write and where exactly. All right, so don't be panic, just start writing now. Then, once you complete writing, you should read your own letter and try to find out any mistakes if you have made and correct. Okay, it's so simple. But if you're reading, I assure you that you will be able to identify one or two minute errors. Okay, but you should not be panic. Just make it clear. Okay, and try to write it with pencil so that you can make changes if you want later on. All right. So this is how you should perform. Now let us start by discussing on the test like later format. Okay, first let me explain you in which format you should write a letter. So at the top of your letter, you can write today's date. Okay, that will be the day of exam. Okay, now if you are practicing with the old material, make sure that all the dates will be of past. But when you are taking the test, all the dates will be recent. So you will not get confused. And at the top of the letter, you need to write the date that you on which day you are writing a letter. So in the exam, definitely this will be the date of your test. Okay. Then you should leave one line blank. Then write the name of the reader. Okay, it will be given into the writing task. Most probably, if given, you write. If not given, you should not write. But all this information, name of the reader or profession of the reader, and the address will be provided into the case note. So you just need to pick up from there and write it here. Then you should leave one line and write RE line. Here you need to write the patient's full name along with the age or date of birth, whatever is given in the task. Again, you should leave a line and then put a salutation mark. That is, Dear Dr. Smith, or Dear Sir or Madam, if you don't know the reader. Or you may write that, Dear Nurse, Dear Doctor. So, based on the given information, you need to begin with the salutation. Then you should leave a line and start writing introduction. Now, introduction should have three main information, that is full name of the patient, the current issue, that means current problem of the patient, and the reason of writing a letter. These three information should be clear into the introduction paragraph, and there should not be any other additional information. If you want to write, you can write down into the body paragraphs. Now, body paragraphs can be of two types. You can write chronologically, that means as the patient has presented to you, or you can write thematically, that means according to the priority. So as you will proceed with me in the upcoming videos, we will be discussing of both the types. Okay. And the last body paragraph can be of your request or recommendation paragraph. Whatever you are expecting from the reader to do, that will be elaborated into the last paragraph. Then you should have a closing phrase that is something like, please feel free to contact me for any queries. So it is just a formality, but you need to write it as it is a test format. And then you can write yours sincerely to close your letter. Leave a line again and write your designation. Never ever write your own name. Okay. Your designation, whatever is given into the task, or you can write your own designation, nurse, doctor, pharmacist, whatever. Okay, but you need to check what is given into the case notes. Okay, if it is given, you should close it with that designation. Okay, so I hope you are now clear about the test format. Now let us look at the task. Through the task, I'll be able to help you to understand whatever we have discussed up to now. As you can see, here is the task. Okay, and this is for nurses. 5 minutes to read, 40 minutes to write. But as I said, you should not jump into writing directly. You may make errors. We don't want that to happen. And here, this is the writing case notes. Okay. And at the bottom, you can find writing task. Through the writing task, you need to identify four things, basically. The first is type of letter. Second is reader. Third is reason of writing a letter. And probably you may come to know whether the reader is known or unknown to the patient. Let us try to read this writing task and then we will identify these four things. Now, as I said, for initial 5 minutes, you are not allowed to put any tick mark. So I am not going to put any tick mark because I am also reading it for the first time with you. And then we will be looking at the selection, organization, and I'll give you the model answer. Okay. So here, using the information given in the case notes, write a discharge letter to Miss Georgine Ponsford, resident community nurse at the community retirement home, 103 Light Street, Newtown. This letter will accompany Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So we have come to know that it's a discharge letter to the resident community nurse. She is responsible to provide continued care as the patient is going back to the retirement home, right? And after discharge. So probably we are expecting ongoing care and management. And the task says that Mr. Ramamurthy is going back to the retirement home. That means the reader is already known to Mr. Ramamurthy. Okay, community health nurse, here resident community nurse knows Mr. Ramamurthy. Okay, now let us read it from the top. Assume that today's date is 10th February 2019. Mr. Lionel Ramamurthy, a 63-year-old, is a patient in the medical ward of which you are charge nurse. So you need to start thinking that, okay, Mr. Ramamurthy is 63-year-old. Start assuming 63-year-old patient and I am a charge nurse. I'm looking after this patient. Hospital, Newtown Public Hospital, 41 Main Street, Newtown. Patient's detail, name Mr. Lionel Ramamurthy, marital status widowed, spouse deceased 6 months ago, residence community retirement home Newtown. Now this confirms that patient is going back to the same retirement home because this is what we have seen. The residence is community retirement home Newtown and we have seen the same Newtown here at the writing task. Okay, community retirement home Newtown. So that confirms that we are sending patient back to the same retirement home. Okay, and so the reader is already known. Next of kin is Jack, engineer, 37-year, married, 3 children under the age of 10. Seen, teacher, 30, married, working overseas, 1 infant. Admission date is 4th February 2019. Discharge is 14th Feb 2019. So here we can see that patient has been with us for few days and diagnosis is pneumonia. Past medical history says patient has osteoarthritis, mainly in fingers, and patient takes Voltaren, that is diclofenac. Eyesight is reduced due to cataracts removed 16 months ago, needs checkup. Social background, retired school teacher, history maths, financially independent, lonely since wife died. Weight loss approximately 4 kg in 6 months associated with poor diet. So now I may start thinking that, okay, this is the information. Patient has osteoarthritis, decreased eyesight, school teacher, weight loss. Okay. Just read it to understand, not to mug up, not to learn, not to select. Just try to understand. Okay. Fine. Let's go ahead. Medical history says 2007 type 2 diabetes diagnosed, controlled by diet. 4th March 2080 COPD diagnosed. Medical background, admitted with pneumonia. Now, when patient came in, patient had pneumonia. Acute shortness of breath, inspiratory and expiratory wheezing, persistent cough led to chest and abdominal pain, fever, rigor, sleeplessness, generalized ache. On admission, mobilizing with pickup frame, assist with activities of daily living like showering and dressing, very weak, ambulating only short distances with increasing shortness of breath on exertion. So we have seen that patient is presented with the signs and symptoms of pneumonia, okay, mobility issues, and so on. Medical progress now shows that he is afebrile, inflammatory markers back to normal, slow but independent walk and shower toilet, dry cough, some chest and abdominal pain, weight gain 1.5 kg, post reviewed by dietitian. But something is missing, right? Here we have seen patients' complaints and here we can see progress. Then what we did to gain this progress is nursing management. So encourage oral fluids and proper nutrition. Ambulant as per physio review. Encourage chest physiotherapy, that is deep breathing and coughing exercises. Sitting prefer to lying down to ensure postural drainage. So these all are the implementations that we have done, and finally we have got the result with the patient's progress. Assessment, good progress overall, of course, we can see. Discharge plan paracetamol if necessary for chest or abdominal pain. Keep warm, good nutrition, increase fluids, eggs, fruits, veg, and needs health monitoring diet. So this is what we are expecting from the reader to do regarding this patient's information. Now let's think that my initial 5 minutes are over. I have gone through the writing task and the case notes. Now I will start selecting the case note and I'll think whether I need this information to give to the reader or not. Okay, so here I will think that okay, Mr. Lionel Ramamurthy, 63-year-old. Yes, it's important information. My role is charge nurse, so yes, this is also important. Hospital, well, no, I'm not going to write my address. Here I have already mentioned. Now the reader is already known, so I will not need to write any marital status or residence. Nothing is important. Next of kin also the reader knows. I may write about patient's admission date, discharge date, patient's diagnosis. I don't need past medical history. I don't need any background, right? And I don't need any medical history as well. I believe that the reader is already known, so I won't write any of this information. But while reading, I came to know that patient has some issues with the diet, and we have referred the patient to the dietitian. So I will write this information as well about weight loss. Okay, I will definitely write all the complaints of the patient. I will write all the medical progress of the patient, and I will also write the nursing management. I'll write assessment as well and discharge plan. So this shows that the information from medical background till the end is relevant. Okay. So now I have selected all the relevant information for the reader. Now I need to think that in which sequence I'm going to arrange my lecture. So I'll think that should I begin with writing weight loss? Well, currently, patient has pneumonia. So it is better to write with the most relevant information. So no, weight loss isn't my priority. Should I write with the admitting complaints? Yeah, that sounds really good. We can begin with medical background. Now, should I write medical progress? Well, my reader will be confused. What happened? Patient came in with the complaints and immediately got the result? Was it magic? No. This is not the right information. This is not the right sequence. I may write about the nursing management as a second body paragraph, and then I may write about the medical progress. And finally, I can make requests, right? So this will be the correct organization. But if I am planning to secure B and above, I would love to play with this information. So what can I do? Now let me select with the different colors so that I can help you to understand how I separate the information. So here I will begin with admitted with pneumonia and all pneumonia related complaints. Then I will begin with the management that is relevant to the pneumonia, that is chest physiotherapy, and sitting preferred to lying down to ensure postural drainage. Now you know that pneumonia is accumulation of fluid into the chest cavity, and when you give Fowler's position, propped up position, okay, that ensures postural drainage. Okay, there will be a shift of fluid. So that is also a relevant information for the pneumonia. So I will write this as well along with the complaints. Okay, and then I will see what was the outcome. Okay, patient is afebrile, inflammatory markers are back to normal, patient still has some dry cough and chest and abdominal pain. So that is the outcome of what management we have provided. So this can be my first body paragraph. Now I will write about the patient's mobility issues. That is, on admission, patient was mobilizing with pickup frame and activities of daily living and all these things associated with the mobility. What we have done to improve the patient's mobility is ambulation, right? And it was done by the physiotherapist, right? And then patient is slow but able to walk independently, car and toilet. So this is how I will jot down the information. You really needed to pick the information and connect it. You can see how I'm trying to connect it to form a story. Okay. And last but not least, I will take the weight gain issues. And here, patient said that he lost 4 kg in 6 months because of poor diet. And we have referred the patient to the dietitian who has advised increased oral fluids and nutrition. And ultimately, patient has gained 1.5 kg. So this is how this will be my third body paragraph. And finally, I would prefer to write all these requests into my last paragraph, right? Does it make sense? All right. So let us see now the model answer. Let me share my screen with you with the model answer. And if you would like to have this model answer with you, you will need to get connected with me through my contact details. Okay, so let's see this. Here you can see I have written today's date because according to the task, assume that today's date is 10th February 2019. So according to the given information, I have assumed that today is 10th February 2019 and my patient will get discharged tomorrow on 11th Feb. Okay. I have left the line and here Miss Georgine Ponsford, as you can see that this information is given at the bottom. Okay, so Miss Georgine Ponsford, resident community nurse, community retirement home, 103 Light Street, Newtown. So this is the entire address and information given here that you just need to write it here. But you can see I haven't put any commas or any punctuations. Then you should leave a line and you can write RE line where I have mentioned patient's name and age, and then the salutation with Dear Miss Ponsford. Now, name is given, Miss is title, and Ponsford is a family name. So, when you are addressing the this reader for the second time, you just have to write the title and the family name. Dear Miss Ponsford. This is the formal way of beginning. And if the name is not given, you may probably write that Dear Nurse. Okay, sometimes they do give names, sometimes they don't. So, you need to be flexible according to the given task. Now I will read this information and you can understand that the way we have discussed, I've written the information here. Dear Miss Ponsford, I am writing to return Mr. Lionel Ramamurthy, who has been recovering from pneumonia, for ongoing care and support following his discharge tomorrow. So, introduction paragraph has patient's full name, reason of writing a letter, and the current issue. Patient has been recovering from pneumonia. Patient has not been recently diagnosed. Okay, what is his overall condition? He has been recovering well from pneumonia, right? So that is how you need to be presenting your information. On 4th to 2019, so I have started with the patient's admitting date, okay, 4th February. So on 4th February 2019, Mr. Ramamurthy was admitted due to pneumonia. He complained of acute shortness of breath, inspiratory and expiratory wheezing, persistent cough which resulted into chest and abdominal pain, fever, vigor, sleeplessness, and generalized ache. Therefore, he has been um, positioned propped up and receives chest physiotherapy. As a result, his inflammatory markers have been normal. However, he has dry cough and some chest pain. So here you can see that I have jot down the patient's complaints, followed by management and then the progress. Now about the mobility. On admission, Mr. Ramamurthy was mobilizing with pickup frame and required assistance with activities of daily living. He could ambulate only short distances with increasing shortness of breath on exertion. Following physiotherapy, despite slow movement, he can walk, shower, or toilet independently. During hospitalization, now third paragraph coming to the weight issues. During hospitalization, Mr. Ramamurthy reported that he had lost 4 kg in 6 months. Therefore, he was referred to a dietitian who advised oral fluids with appropriate nutritional intakes, because of which he has gained 1.5 kg. So you see that how simply the information is delivered, right? Now let's make request. Final paragraph with all the requests. I therefore would like to request you to monitor his diet, which includes high fluids, eggs, fruits, vegetables, and so on. Please administer paracetamol for chest or abdominal pain, and he also should be kept warm. So all these three information has been provided here as a request. And then the closing phrase, should you require any further information, please feel free to contact me. Yours sincerely, charge nurse. Now this is already given at the top, charge nurse. Okay, so I'm closing here with the charge nurse. All right? Yes. So, my dear friends, I hope you have understood how OET writing works. And in the next video, we are going to discuss on assessment criteria. Okay, the letter which you write will be examined by the examiners, and you need to understand that how it is going to be examined, right? So, I hope that we'll meet soon in the next video. All right, till then, bye bye.